Hello everyone, this is Dr. Michael Homer from Reproductive Science Center, and I wanted to talk to you today about the coronavirus vaccine. As you know, it's now starting to become available, and one of the bigger questions, especially for our patients, is should I get it when I'm pregnant, or can I get it when I'm pregnant when it becomes available to me? So looking at the current literature and the data, our belief is that pregnant women should be allowed the opportunity to get the vaccine. Looking at the statements from the American College of Obstetrics and Gynecology, from the American Society for Reproductive Medicine, and for the Society for Maternal Fetal Medicine, all in agreement, pregnant women should be allowed the opportunity to receive the vaccine, and we agree with that. So, as many of you probably know, pregnant women were not included in that trial. So therefore, it's impossible for us to determine with 100% accuracy if the vaccine is safe for those who are pregnant. But we also know the risk factors when a pregnant patient contracts coronavirus and develops COVID. That can also be very bad. So this personal decision that you have to make is clearly going to be something done between you and your healthcare provider doctor. Some things to think about. What is your risk factor for contracting coronavirus? Do you have a job where you can stay at home and sort of isolate? Or do you have a job where you have to be out in the public? Small children at home that have to be in daycare. How about your social life? Are you keeping very close to home and keeping a very tight or very small social circle? Or are you making exceptions here and there and putting yourself at slightly higher risk? That's everyone's personal choice, and that would play a major role in deciding whether to receive the coronavirus vaccine or not. We know that the coronavirus vaccine has some side effects. It's not a lot. After the first shot, we know that 4% of patients developed a fever, 16% developed a fever after the second dose. A small fever that's controlled by Tylenol is not considered to be dangerous for pregnancy. And when we think about vaccination recommendations from all the societies as well as ourselves and doctors everywhere, if you're receiving vaccines during pregnancy is something that's commonly recommended. Vaccines for the flu, diphtheria, all of these are recommended during pregnancy, and sometimes they can cause a small inflammatory or immune reaction, which might lead to fever or fatigue. But this has been proven to be extremely safe in pregnancies, and therefore we don't necessarily think that the coronavirus vaccine would act any differently for pregnancies. We know that parenting is full of choices. Every parent wants to make the best decision for themselves and their child or unborn child with the best amount of information that they can have at that time. We here at RSC are here to help. We will be looking at the information as it comes in from the CDC and from the trial data as well. And we're here to help you guide to make the best decision for you and your family. Take care. Bye.